Basically, the procedure follows the temple hairline rather than the earlier incision of going straight ahead through the scalp hair, and then it follows the tragus and then goes behind the ear and then to the hairline, above the hairline again, and then the skin is lifted and then the smash layer is lifted up to reach the facial framework of the face, and then the neck is done separately where the platysmal bands are isolated and which is dissected right up to the neck, and the division of the bands are done and then muscles are brought together if there is excess fat in the supra level under the skin which are excised and so on. And then in some selected cases liposuction of the neck area is also performed, and braids are used for limited period, maybe overnight, and then they are removed.
My approach to tummy tuck is it depends on the patient whether it's a standard tummy tuck or extended tummy tuck. Extended tummy tuck, I use skin crease incision, the suprapubic area going above the anterior superior iliac spines, and sometimes I use double shape incision, and again upper part follows the skin crease incision, and then standard abdominoplasty technique, and I use the technique called high lateral tension abdominoplasty. The advantage of this technique is it reduces or minimizes seroma formation, as well as there is less tension on the suture line. So early can mobilize early, and there is hardly any tension on the suture line, and very little seroma formation, because we use squilting stitches. This technique is called high lateral tension abdominoplasty, and this is sometimes I combine with liposuction of hips and flanks and thighs, and sometimes I do liposuct the epigastric area depending on the patient's requirement.
My basic pattern is Elizabeth, what is described by Elizabeth Paul Finlay, with it's called a lollipop scar, where with the medial pedicle I have stopped doing lateral pedicle anymore. Medial pedicle gives very good results. Nipple sensation is very satisfactory, and the beauty of the procedure is it's only a circumareolar and a vertical scar, very rarely a Marshall T or just a J. And then reduction is completed, and then I would like to recreate the inframammary fullness, and I always maintain the medial fullness, superior breast fullness, and then I hitch the lateral breast so that the lateral bulging is reduced, and it has given me a good result, and most of the patients are happy, and few complications, none at all in the past so many years, and I'm very happy with the results.
Post-operative, I encourage patients to have a normal diet, a lot of fluids, and mobilize them as early as possible. I use pressure garments depending on the surgery. The abdominoplasty, I use a binder, abdominal binder. After liposuction, I use pressure garments. Breast reduction or breast augmentation, I use nicely fitted bra, and depending on the surgery, they give post-operative instructions what to do and what not to do. And post-op medications, we give painkillers and antibiotics for a certain period of time, and see them on regular intervals in terms of wound, and see whether the pressure gowns are fitting nicely and whether they have any other problems.
Apart from the surgical procedures, we have a great hospital here at Apollo with all the facilities, including the theatre facilities. write-up mobilization and the specialized pressure garments and so on. And then post-op care, we ensure that it's not delegated to very junior staff, and it's a very personalized care from change of dressings to application of dressings, and if there are suture removals, all that will be done by very trained staff. And also post-operatively mobilization, and then back to another accommodation level, and then once they are fully mobile, we can also offer some places to visit in our country. There are so many places to see. So depending on the patient and the procedures, we would recommend those patients to visit those places, and to make this not only a surgical experience, but on the whole, holiday home surgical experience. Yeah, we have a personalized service. Our therapists are personalized, selected personally, and we know that they have the necessary experience and backing and guidance. And then I think we have the backing and all that to give a good service which is comparable to anywhere in the world.